Let me ask you a question about the reporting of deaths, because it's been very controversial about the accuracy and the qualification of COVID-19 deaths. It became even a meme about a month ago, Doctor, where people were saying that, a husband shot his wife at home because he couldn't stand being around her, and it was because of COVID-19, because they were locked at home. These kinds of things. And so, we saw Italy with all these cases, and then one of the members of parliament came out and said, 99% were comorbidity. And then other people said that wasn't true. We saw aspects in America where we thought people were getting financial benefits for that. And this obviously caused mistrust in the public, which then doesn't help when you ask them to wear masks. What's your stance on all of this? Was it misreported? Was that happening?
No, look, what you're talking about is what's the impact of the virus. And in this case, people with comorbidity, what was the probability of their dying? And this is only, in the last 5 months, what's the probability of their dying from that comorbidity? What's the probability of their dying because they're over 60 years old? And the missing ingredient in this equation is the virus. The virus, in the United States, there are 140,000 people that celebrated New Year's this year that are not alive today. And it's safe to say those 140,000 people, with fine-tuning a few here and there, would still be alive today if it wasn't for that virus. That's fundamentally what you're talking about.
Yeah, it is and isn't. It's just some people have said, an autopsy report, I've been forced to put COVID-19. I never had to do that before. I just talked about what they died from. Other people say you're not taking into account what people would have died from naturally. Trump was on last night saying that the median age was 78. And maybe we can get into the ramifications of the lockdown on the back of that. I mean, there are some reasonable questions here, are there not?
No, I don't. Look, what we're talking about, what is the impact of a virus on public health? And as I said, there are 140,000 people that are dead that are attributed to this virus in the United States. You could go through all of those and sort out how many of those would have died if the virus hadn't been around. And it'll be a very small fraction. There may be a relative handful, but then there are lots of people who died. Remember, you're only making the attribution of a COVID-19 death if what you've done is confirm they had COVID-19. There are lots of people who are dying who, in fact, have not had a COVID-19 test, and they may have died from COVID-19, but because they didn't get a test, it will not be attributed to COVID-19.
Yeah, well, some were being attributed without even a test, I was told. But let me ask you another question.
I think that's part of the problem, is that there's a lack of uniformity in how the numbers are counted. And I think that's part of the chaos that, we've seen the absolute lack of singularity in the response to this virus. And among those lack of singularity is having a clear case definition that becomes uniformly and universally applied. And we don't have that. So we're comparing apples and oranges. But if people want to use that argument to say that this virus is less deadly than it is, that's a misinterpretation, because you're losing both because of this lack of uniformity. There are people who did die because of this COVID-19 that are not attributable because they didn't get a diagnostic. And then there are people who died from this virus, who are attributing to COVID-19, even though they may have been in the final stage of cancer, and it pushed them over the edge. So all of these things, and fundamentally, I think people are focusing on arguing on the edges of the issue, as opposed to the fundamental issue is that there are people dead today who never should have died because of this virus. That you have 58 people in Southeast Asia and 140,000 in the United States. It's inexcusable.
It's just still strange to believe. But also the test itself is flawed. I mean, there are false positives and false negatives even in the test itself.
Well, again, that's one of the remarkable failures, and quite frankly, the few number of tests that are actually available. it's really quite extraordinary that this far into a pandemic, that two things. We have the technological limitations to testing that we do have. People will wait a week in order to get their results back. We don't have a point of capture diagnostic, essentially a rapid diagnostic, that there wasn't a significant pool of resources put out on the table for industry to essentially give us the equivalent of an early pregnancy testing capability. If there were billions of dollars put out there, we've already spent multiple trillions of dollars as a consequence to this virus, that we haven't been smart enough to really energize and focus industry to give us a home-based, easily used technology that would allow everyone to know whether or not they're infected or not is really quite profoundly inexcusable. And then the issue with the quality of the tests is really quite extraordinary. Yes, false positives, false negatives. We have a really difficult time answering the question, are people reinfected after they've survived a first infection? We're finding lots of examples of people that are showing positive after they've presumably been cleared of this virus, but we don't know whether it's a testing problem, that they really weren't cleared, that there was still virus there. So we have the technological capability. What we don't have are the incentives to drive the availability of this kind of technology so we get clear, unambiguous, and rapid determination. And this becomes even more complicated when you think there's estimates now that 30 to 40% of the transmission of this virus is attributable to people without symptoms. So, not knowing that you are infected, but you are, and you're transmitting this virus, that you don't know that, or the person you're sitting across from is infected and transmitting the virus. And at this point in time that we lack that information, and we lack the technology to be able to rapidly get answers to that, is I just find extraordinary. That we could have had a quote unquote, a Manhattan-like effort to generate this technology and have it widely available. And we're going to still need it over the course of the next year or two.